Walk-in dispatch for a patient that's complaining of chest pain and shortness of breath. Walk in, see a patient sitting up, talking to you, introduce, hi, I'm Matthew, I'm paramedic. What's going on today?
Hey, I'm having some chest pain and my breathing's a little...
Okay, I can see that you're having a little bit of trouble breathing. I'm going to get my partner just to take some vital signs, starting with your SpO2.
Sure.
I mind if I just feel your heart rate here? But I can see that my patient is obviously breathing adequately. They're talking in a coherent manner. And we'll allow Matt to just talk to me normally and not have to hyperventilate through. So I feel a nice regular pulse. Partner's getting a set of vitals. Is it okay if I have a seat?
Go ahead.
So when did this all start?
About 25-30 minutes ago, I was out mowing my lawn and I started having like some chest pain and found it kind of hard to breathe.
Okay. Anything as far as time, how long did it take for that chest pain to start all of a sudden?
It was over a couple minutes.
Over a couple minutes?
Yeah.
And has it got better or worse since it started over the last 20 minutes?
The breathing's been getting worse.
Oh, the breathing's been getting worse.
Yeah.
Okay.
It started with some like chest heaviness and then I found it hard to catch my breath.
Yeah, and we'd be very interested. Let's say my partner has SpO2 and we see SpO2 is above 95%. So in this suspected cardiac patient, we'll just leave that at the time being. Is anything, and it came on while you were cutting the grass, and you said that it hasn't changed a great deal. Has the pain got worse over the last 25 minutes?
Not so much worse, no.
Just the shortness of breath.
The shortness of breath kind of came on and got worse.
Got worse. And do you have any other symptoms? Are you feeling nauseated or anything like that?
Maybe a little bit, but not really. No,
Okay.
It's mostly just the breathing in the chest.
Okay. Anything make it better or worse?
No, I came inside to kind of rest, thinking that would help, but it hasn't helped at all.
Okay.
And moving doesn't change,
Okay. Nothing seems to make it better or worse. Okay. If you were to rate your chest pain that you're having, 10 being the worst pain you've ever had and 0 being none, what would you call it?
It's probably a 5 or a 6. It's not the worst thing I've ever had, but it's certainly not comfortable.
Okay. And what about your shortness of breath?
It's probably around there as well. Yeah, it's kind of hard to breathe.
A 6 out of 10?
Yeah.
Okay, and 5 or 6 out of 10. We'll say 5 or 6 out of 10 for the chest pain.
Sure.
What do you want to say?
5.
5.
Yeah.
Okay, so if I'm understanding, you were cutting the grass and you started to get some chest pain, came in, it hasn't relieved that, but you have noticed that your shortness of breath has got worse from when it started. Just started with a little bit of shortness of breath and now got more. Okay, we're just going to get into some of your past medical history. Do you have any allergies?
No allergies, no.
Okay, are you on any medications?
Atorvastatin and metoprolol.
Okay, and what do you take those medications for?
High cholesterol and high blood pressure.
Okay, and you take those medications regularly?
Yes.
No recently discontinued medication?
No.
And you've been on those meds for a while, have you?
Yeah.
Okay. Any diagnosed problems with your heart?
No.
Has anybody ever told you have angina or had a heart attack?
No.
No history of irregular heart arrhythmias or irregular heartbeats?
No.
No problems? Any problems with your valves?
No.
No history of any infection or inflammatory conditions of your heart? Pericarditis, endocarditis, anything like that? Any congenital heart defects?
No.
No. Okay. In the past week, have you had any episodes of this chest pain or shortness of breath in the last week?
No.
Nothing like that. And you say this pain feels heavy and radiates in the shoulder. It's not sharp, or you describe it as heavy and kind of dull.
Yeah.
Where is it? Can you point to it?
It's like right here.
All over there.
Yeah.
It's not in one spot. Okay. It seems like visceral pain. You haven't had any recent weakness or kind of dizziness or feeling like you're going to pass out?
No, not really, no.
No fainting episodes? You have high blood pressure. Have you been monitoring your blood pressure? Any high or low blood pressure?
No, I don't monitor it, no.
Okay. Just as far as risks for having a heart attack, do you have any, have you had any recent surgeries or been kind of sitting in one spot for a long time, plane trips, or sitting at a desk for hours and not moving? Are you a smoker?
An ex-smoker.
Okay, how many years ago did you quit?
Maybe 6 years ago.
Okay, and you do have high cholesterol, and you do have high blood pressure. How many minutes a week would you spend walking or per day?
Just out around in the garden doing some work, so maybe 30 minutes or so.
30 minutes a day. And I would see if my patient's obese. Do you have any history of diabetes?
No.
Any family history of heart disease?
Dad had a heart attack.
Okay, and how old are you, sir?
65.
Okay, and he's male. And are you under any excessive stress lately?
No more than normal, no.
How much alcohol would you drink? How many drinks would you drink a week?
A couple beer on the weekends.
Okay. And because you're short of breath, we're just going to ask you some lung problems. No history of any COPD or obstructive lung disease, asthma, anything like that?
No.
No recent respiratory tract infections or exposed to any
No.
that you're aware of? No. And no history of any lung tumors or
No.
anything of that nature? Never been told you had a pulmonary embolism?
No.
And no interstitial lung disease?
No.
Okay. Have you had a cough lately?
No.
No, thus not having any sputum. And haven't been waking up short of breath at night, have you?
No.
And no excessive, we've already said, no excessive shortness of breath that just seems disproportionate to what you're doing.
Yeah, no.
Walking upstairs and getting exercise.
No, nothing recent.
You said you were a smoker. You don't vape now, do you?
Nope.
Okay. And you don't have any environmental allergies?
Nope.
And no family history of lung disease?
Nope.
Do you have any illicit drug use, no IV drug use whatsoever? No. Lovely. Do you ever have any problems with your stomach? Been told you have any stomach or esophagus, liver
Nope.
diseases of any sort? No reflux? Do you take Tums lots or prone to kidney acid reflux?
No, not really, no.
No. No cancers?
No.
No ulcers or hernias?
No.
No issues with your gallbladder?
No.
And you're not nauseated now and haven't been recently. Felt like your appetite's been okay?
Yeah, it's been
Yeah,
good.
bowel movements are normal. Taken any over-the-counter medications?
Ibuprofen occasionally for like a bad back, but nothing excessive.
How much would you take in a week?
Oh, maybe only 2 or 3.
2 or 3. And no travel to developing countries?
No.
Any history of any neurological or psychiatric problems?
Nope.
Problems with your bowels?
Nope.
Urinary or reproductive issues?
Nope.
Your urination's been normal?
Yep.
And no endocrine problems?
Nope.
Hypothyroidism or anything of that nature? You
Nope.
already said you're not a diabetic. And you haven't been lifting or moving anything? Cutting the grass is normal for you?
Yep.
You don't feel like you did anything that could have strained a muscle?
No.
And that could be causing our problem too?
No, it's just normal work, just mowing the lawn.
Any ongoing medical testing?
Nope.
And when did you last eat?
I had some breakfast.
Okay. How have you been feeling the last day up until these events started?
I've been okay.
And the last week was fine?
Yeah,
And
yeah.
nothing abnormal in the last month?
No.
Okay, we're just going to do your physical assessment if that's okay.
Cool.
And we'll just start off with your head and looking for any scars, rashes, or lesions, which I don't see any. I'm just going to have a look at your eyes. I can see that they're nice and pearl. I'm just going to touch your eyelids here and just look and see no anemia. Can you open your mouth and stick out your tongue? Nice moist mucous membrane. I'm just going to tip you back just for a second, seeing as you're on our stretcher just to a 45. Can you just turn your head? Okay, and just the other way. I don't see any elevated central venous pressure here. I'll set you back up here so that you can see what's going on. And expose his chest. Any scars, rashes, or lesions? Okay. And that pain, when you push on that spot on your chest, does that hurt at all?
No.
Okay. When you take a nice push in for me, there you go. Take a nice deep breath. Again, nice deep breath, and that doesn't hurt or change anything at all. Okay. No, chest looks the appropriate size. Don't see a barrel chest. I'm just going to listen to your lungs to start. Can you just breathe in and out through your mouth, please? Good. And again. Okay, air it sounds clear. You can just breathe in and out through your nose. Just breathe regularly. I'm just going to listen to your heart, okay? And obviously, I wouldn't be listening through his shirt for lungs or heart sounds. Just going to tap on your chest, okay? Any pain in your belly? when I touch here? Does that aggravate your pain at all?
Not really, no.
No, nothing there at all? I'll lay you down here in a second to just see if anything is aggravated. But that's all, it seems nice and soft. No scars, rashes, or lesions that I'm seeing at this point in time. If I push up in this corner here, if you exhale, blow all your air out, tuck in, take a deep breath for me. That doesn't change anything? Doesn't make anything better or worse. I don't see any incontinence. Okay. The extremities, no scars, rashes, or lesions. Just have a look at your ankles. You said you haven't had any swelling. I don't see any pedal edema. Cap refill seems to be brisk. Temperature is the same. You can feel that on both sides. Push down for me. Great. Same, can I just see your hands? So look at your nail beds. No scars, rashes, or lesions. No clubbing of the fingers. No pulmonary erythema, looks all normal, and you can squeeze my hands for me. Good. So I'm just going to sit down and gather my thoughts and think through, get my vital signs back from my partner, look at my cardiogram, and decide on work through a differential and decide on a diagnosis.